Oral questions. I recognize the Leader of the Opposition.
Thank you, Mr. Speaker. We've obtained internal government documents that show senior health administrators have major problems with this government's $40 million lean consultant. Right. Senior health administrators, Mr. Speaker, say that John Black lacks respect and actually tattles on leaders if they question what is being done, Mr. Speaker. They say that training is irrelevant and that it is insulting. They say it's a bunch of dogma, Mr. Speaker, that actually doesn't even bring improvements. And they say, Mr. Speaker, flying in senseis, $3,500 per day per sensei, is a waste of money. So it's no wonder, Mr. Speaker, it's no wonder that RQHR says this. And here's a quote from the senior administration, Mr. Speaker. Getting out of this will be an improvement, end quote. Mr. Speaker, if senior health administrators are saying the contract with John Black is a problem, that this government has an unhealthy fascination with John Black and with its lean pet project, why on earth, Mr. Speaker, did this Premier choose to renew the contract this summer? Here's a quote. Biggest concern around an early exit of JBA is in the optics it would produce, end quote. The biggest concern, Mr. Speaker, for getting out of this contract are the optics. That's it. That's the preoccupation by this government. The vast majority of doctors, the vast majority of frontline healthcare workers, the vast majority of nurses hate lean, Mr. Speaker. And we know that senior health administrators have major problems with this government's approach to lean. But simply, Mr. Speaker, because of optics, this government is refusing to listen, and it's plowing ahead.
2 days ago, a home here in Regina was demolished due to a fire that was caused by this government's failed smart meter program. It's a direct result of this government's failure to undertake due diligence. And we know that during the trial period, more than a year ago, to test these meters, there were 8 incidents. 8 times something went wrong. But the government concealed that and decided to plow ahead with its smart meter project anyway, and put more than 100,000 of these dangerous smart meters on the homes of Saskatchewan people.
Mr. Speaker, the seniors in Lloydminster say they are sick and tired of falling through the cracks because they live in a border city. It is absolutely unacceptable for this government to pretend it can't do anything to stop the closure of a major wing of the Dr. Cook Extended Care Centre.
Mr. Speaker, with that kind of hit-in-the-sand approach that we see from this government, it's no wonder that they might be a little angry at Maura Davies for saying that she was only getting 1/5 of what was needed in order to properly maintain buildings. It's no wonder that they might be agitated over that, Mr. Speaker. We also know, Mr. Speaker, that Maura Davies was also critical of this government for failing to address the things that actually would help seniors and would improve seniors' care. My question to the Premier, is it because Maura Davies was highlighting the failure of this government to actually meet the senior care needs in this province? Is that the reason why her contract was terminated and she'll receive $400,000 in severance?
This government didn't undertake proper due diligence on the smart meter file and didn't even bother thinking about safety, despite the fact there have been major problems in Philadelphia and Alabama. That minister is a bit of a latecomer to accountability on this file when he's been a big part of the failures every step of the way.
Mr. Speaker, if they had been listening to the advice from healthcare workers and from healthcare administrators, they would not have renewed the contract with Mr. Speaker, it's not just RQHR senior bureaucrats who can't stand lean. My question to the Premier, how much scathing criticism does he need to hear before he will end the toxic and the wasteful contract with John Black? Here's what senior health administrators say, quote, the orientation to the Kanban process within RQHR by the sensei had little added value, end quote. But guess what, Mr. Speaker? This government, this Premier, is still flying senseis from Japan to Saskatchewan and paying them $3,500 per day. Ridiculous. And here's an ad, Mr. Speaker, that ran in the Star Phoenix just over the weekend. Quote, Japanese interpreters wanted. LMN America is seeking professional interpreters to work in the province of Saskatchewan, assisting Japanese Kaizen lean consultants in hospitals in Regina, Saskatoon, and other health regions during workshops on a weekly contract basis. Compensation is $600 per day. My question to the Premier, why on earth is he still flying senseis from Japan, recruiting interpreters, Mr. Speaker, through an American consultant, when the health administrators, Mr. Speaker, say they don't don't actually add any value. Why is he doing that? Here's a quote. Here's what the health minister said on Thursday. Once we transition away from JBA, it will allow us to tailor lean more specifically to Saskatchewan's healthcare system. End quote. Well, Mr. Speaker, why on earth are we paying $40 million when frontline healthcare workers say that it's not working, when senior health administrators, Mr. Speaker, say that they can't stand it, when the health minister himself, Mr. Speaker, says the $40 million American consultant can't even tailor what he's doing for Saskatchewan's context? Why would the Premier insist on flying in more senseis, recruiting more interpreters, all at a time when the evidence says he should be doing the opposite? My question to the Premier, when will he clue in, when will he listen to what's being said in the front lines and cancel the John Black contract?
We learned yesterday that there will not be a proper search process for a new CEO for the Saskatoon Health Region. When over 3/4 of employees say the current leadership is not effective, would it not make sense to cast a wider net and not just recruit from within? And it should not just be looking for someone with depth and passion and lean. To the minister, wouldn't it make sense to do a proper national search for someone with a proven track record in, say, employee engagement and patient safety? Shouldn't those be the priorities?
We know that First Nation schools already receive much less funding than other schools, and the Prince Albert Grand Council is worried about the impact of this new SaskTel admin fee. Grand Chief Ron Michel says, quote, "Our schools cannot afford to cancel or reduce school programs," end quote. To the minister, how can this government justify charging extra to schools that are already struggling?
Senior health administrators saying that Japanese senseis don't bring any real value to this Kanban process. Yet instead of listening to that scathing criticism, Mr. Speaker, we see this government do the opposite. This government is now having the Japanese senseis focus exclusively on the Kanban stuff, the exact thing, Mr. Speaker, that the senior health administrators say that they don't actually even bring any value to. My question, Mr. Speaker, to the Premier, does he misunderstand the criticism that senior administrators have said, or is he just choosing to ignore it? You can organize a supply closet, but you don't need a $3,500 a day Japanese sensei plus interpreter to do the job. And that's precisely what the senior health administrators were saying, Mr. Speaker. The senseis do not add value to the Kanban process. That's what the senior administrators say. But this government, they shovel $3,500 a day out the door for the senseis, $600 a day for the interpreter that's attached to the sensei, not to mention at least $2,000 for each sensei to travel from Japan to Saskatchewan. And health administrators are adamant that the senseis do not add value to the Kanban process. My question to this Premier, when will he listen to senior administrators? When will he listen to frontline workers? When will he listen to his own health minister who says when JBA leaves, we can tailor this to Saskatchewan's needs? When will he come to his senses and end the wasteful and toxic contract with John Black?
For that minister and for the Premier to claim that information about the smart meter problems in other jurisdictions wasn't readily available is absolute nonsense, Mr. Speaker. I understand that the minister received a briefing note dated October 10th, 2012, a full 2 years ago, that laid out major safety concerns about census meters, including, quote, fires in homes of Philadelphia area customers served by PECO, the local electrical utility, end quote. Mr. Speaker, we have a briefing note that minister received. We understand that minister was briefed 2 years ago, more than 2 years ago, by the then CEO of SaskPower, yet that minister has been pretending that he wasn't aware of any of the problems with census. Back to the minister. Does he remember the briefing note? Does he remember his face-to-face meeting? Mr. Speaker, this minister is absolutely skirting around his ministerial responsibility, and his argument that he didn't know about the issues doesn't hold water, Mr. Speaker. The facts suggest something else.
The Premier opposes any incentives for creative industries and wants to see them eliminated right across the country. But, on the other hand, he is bringing in a new tax incentive. This one is for manufacturing and processing. Maybe it will be available to the film industry. To the minister, will this new tax incentive apply to those who manufacture films and export cultural products here in Saskatchewan?
Mr. Speaker, last spring, Laura Cohn came to the legislature. She's 29 years old, and she desperately needed surgery for endometriosis. There are very few surgeons who are actually qualified to perform the type of surgery that Laura ended up needing in Atlanta, and none of those surgeons, Mr. Speaker, are here in Canada. There wasn't any other option for Laura, but the Premier and this government are looking away. Mr. Speaker, what Saskatchewan people cannot understand is how this government has untold millions for its Lean Pet project, but it doesn't have $33,000 to cover desperately needed surgery for a 29-year-old woman. Untold millions for an American lean consultant, $3,500 per day for a Japanese sensei, for each Japanese sensei, $600 per day for Japanese translators, no end of money, a bottomless pit, Mr. Speaker, for its Lean Pet project, but no money for a 29-year-old woman who urgently and desperately needed surgery. My question to the Premier, how can he justify that?
Throughout this crisis, that minister has been adamant that he wasn't aware of any safety concerns. But yesterday, once a briefing to that minister was exposed, his story changed, and he revealed all of a sudden that, yes, he was aware of safety concerns. My question to the minister, why was he pretending otherwise? Yeah. So to the minister, was he negligent? Was he incompetent? Was he asleep at the switch? How can he not remember? Speaker, that Sask Power minister said, quote, if there was information presented and we didn't act upon it, clearly there would be a problem with that and I would resign. End quote. Well, that minister was presented with information about major safety concerns related to census a full 2 years ago. He ignored it. He didn't take it seriously. He didn't act upon it. He didn't ask necessary questions, and he didn't demand protection. So by his own standard and by the standard of ministerial responsibility, the member for Kindersley should be resigning for cabinet. Will he finally do the right thing and do so here today?
Mr. Speaker, 2 days ago, the Premier was asked if it concerns him that the Sask Power minister didn't know about smart meter problems in other jurisdictions. The Premier said, quote, well, I didn't either. I mean, we were aware about the smart meter installation. I wasn't Googling about them either. Neither was any other minister. Went on to say, quote, if this information is not readily available, you assume the appropriate processes are undertaken. It's not something you're going to go out and Google perhaps and find out, end quote. We now know, Mr. Speaker, that this minister knew about safety concerns, knew about fires back in October of 2012, Mr. Speaker. He didn't bother to follow up. He didn't bother to ask the right questions. He didn't ensure Saskatchewan safety was first and foremost. It's time for this Premier to demonstrate some leadership and to fire this minister. Will he do that today?
I recognize the Premier.